Good evening and welcome to the start of the week here on Midlands Today from the BBC. Tonight, 7 hospitals across the region have higher death rates than expected, according to a new report.
The figures from the health research group Dr Foster compare healthcare nationwide. No hospitals in the region feature amongst the top performers.
Near the bottom is Royal Wolverhampton Hospital's NHS Trust, where there were 112 deaths for every 100 expected. After surgery, that rose to 146 patient deaths.
University Hospital North Staffordshire was even worse. There, 116 patients died for every 100 expected, and after surgery, it too had 146 deaths for every 100 expected. Our health correspondent Michaela Paduano reports.
The family of Willersley Lewis can never forgive New Cross Hospital. The 76-year-old was admitted on Christmas Eve nearly 3 years ago with the suspected aortic aneurysm. That's when the wall of the heart's largest artery swells. But it was dismissed as back pain. When the aneurysm burst, a lack of staff meant he never made it to the operating theatre. His wife never got to share with him her MBE for charity work.
He received very poor treatment, no treatment at all. And as for myself, I wasn't even taken in consideration as a family, as a wife, knowing that something serious like this was happening and I couldn't even say goodbye.
New Cross Hospital's ability to operate on abdominal aortic aneurysms is questioned in the latest Dr Foster report. The hospital's high death rate is greatest among the elderly at weekends when fewer staff are available.
The plans that we've got to increase clinical staff across the organisation to make sure that services are delivering across 7 days as much as across the 5 days of the working week, yes, we will be looking to ensure that all patients are managed in a way that we all expect them to be.
This hospital's chief executive, David Lawton, has admitted that its accident and emergency department isn't fit for purpose. There is a new one in the pipeline. But from Thursday, all patients from Stafford who need accident emergency treatment will be brought here to Wolverhampton or sent to Stoke-on-Trent.
University Hospital's North Staffordshire was highlighted as a poor performer in 3 categories, with more deaths than expected among low-risk patients and following surgery.
We believe that this is not an unsafe hospital that does not have a worse than average mortality ratio. I would stress that already this year our mortality ratio is again better than average and that we expect it to continue to do so.
Stafford Hospital performed well this time. It's already transferred some of its high-risk patients and is about to close accident and emergency overnight for safety reasons. Hospital pressure group Cure the NHS believe in cooperation with other centres, but is now concerned.
And we want reassurances from them, from UHNS and Wolverhampton, that they are going to be able to take those cases from Stafford and look after them safely and appropriately, because surely there's a question over that at the moment.
Although West Midlands hospitals perform badly nationally, the hospital death rate has fallen 20% over the past 10 years. Michaela Paduano, BBC Midlands Today.
Well, let's talk now to Roger Taylor, who's the Director of Research for the organisation which wrote this report. A very good evening to you, Mr Taylor. Thanks for talking to us.
Good evening.
Some shocking statistics coming out, such as one hospital having higher death rates at the weekend because there's not enough staff. It seems incredible. Did the results shock you?
Well, in a way that they didn't, in that for a long time people have suspected that this is the case, and it has been discussed in previous reports, and policy documents have suggested that lack of senior doctors out of hours may be a problem and it may be a cause of higher than necessary death rates. What's surprising is that it's taken us so long to get to actually establish this. What we did was we collected the data from hospitals about the number of doctors present in the hospital at nights and at weekends, and what we found was exactly what people have for a long time suspected but not known, which is, yes, it does make a big difference. If you have more senior doctors in the hospital at the weekend, you have better death rates.
Well, that seems a pretty simple thing that even I would know. Why aren't there enough then?
No hospital is going to be able to provide every possible service 24 hours a day, 7 days a week with the most experienced consultants.
Is that down to money? Sorry to interrupt. Is that down to money, though?
Yes, that we simply as an NHS could not afford to do that. But what we have to do is we have to be honest about what hospitals can do really well and where they might need help or they might need to work with other hospitals to make sure that they're covering patients all day, every day. So there is some work to do in terms of how we organise care services. There is a lot that I think parts of the country, particularly the Midlands, might be able to learn from other parts of the country. We've seen in London a very successful reorganisation of stroke services where instead of having 24 hospitals all trying to treat strokes and some of them doing it well and some of them doing it poorly, what we have now is just 8 hospitals which are the specialist stroke centres, and all the other hospitals just make sure the patients get to the right place where the expert doctors are, where all the kit is necessary to diagnose them and provide the treatment.
OK, Mr Taylor, I'm really sorry to cut you off there, but we have run out of time. Thank you very much indeed for making those points, though.
Thank you.
Coming up later tonight,